we as the Ministry of Health are taking all measures to ensure that we protect Kenyans and we protect Kenya from international health outbreaks. And so far, we are dealing with an international public health outbreak for Ebola that is in DRC. As you note, we as Kenyans have a very strong healthcare response system. We are also very strong when it comes to case management in terms of infectious diseases in general. And when we talk about case management, we mean hospital preparedness. We have the highest isolation capacity in the entire country, most of it that have also been built over COVID. And when it comes to infectious diseases, as an expert and a professional, I think many healthcare professionals all over the world will confirm to you that the protocol is nearly the same. It's about protection of the health worker. It's about protection against what we call infectious prevention and control in terms of the spread. And it is about ensuring that we mobilize to support the patients and treat them. And so far, 2,200 healthcare workers have been trained. But you also know that Kenya has been at the forefront of international response. In 2015, the country that was relied upon by the world to send 157 experts to help Sierra Leone contain and tackle Ebola from 2014 all the way to 2016. I have even been privileged to be part of the health experts that were in DRC and Rwanda border in 2013, and we were more than 90 of us. All of these are health workforce capacity that no other region, no other country has. And so one of the things we want to ensure the country is that we are capable of what we call case management. The other thing is about laboratory. KEMRI is the fourth most prepared laboratory in the entire world when it comes to infectious diseases. As a matter of fact, even the countries that are having outbreaks, when West Africa had the first Ebola outbreak, when there was no vaccine or treatment for the other strains, just like right now there is a new strain that has no vaccine and has no treatment. It is laboratories like KEMRI where they were bringing samples. Right now, I can tell you without a doubt that countries in our neighboring region are actually relying on KEMRI as a reference laboratory to send their samples to confirm these cases of Ebola. So we are in a very good space when it comes to laboratory strength. We also have key logistical advantage. As you know, we have a last mile distribution from KEMSA. We also have other mechanisms of distribution. That is why we are relied upon even by the international community. The World Health Organization, the UN body that is in charge of health, currently is setting up a logistics center here in Kenya. The Africa CDC has also identified Kenya as the vantage place from where they can do all the logistical arrangements for the entire continent. Kenyan government continues to protect the Kenyans. But as we continue to protect the Kenyans, we cannot abdicate our obligation and our duty in global health security. This is what we have been known for decades. That is why Kenya is the place where we've done malaria research. This is why Kenya is the place where more than 100 countries send cases, polio, for testing. That is why Kenya is the country that is relied upon when there is problems such as COVID-19. We had hundreds of international patients coming to Kenya. And just like we also may send some of our patients, including, for example, cancer patients, to other countries, you know, this is our expertise. So this is the time to show up. This is like a marathon has been called in London. Do you say that you're not going to send Kenyans there? This is our expertise. And so from that perspective, we are very confident as a country and as a government that number one responsibility is to protect the Kenyan. But as we protect the Kenyan, we can also extend this expertise, we can also extend this experience in the broader global health security response and assist the region, because outbreaks do not care about borders. They do not care about opinions. And you cannot close yourself and say that, oh, you know us, we are good, we are Kenya, we will protect our borders. and then just forget about it, And if we are to really look at our contribution to One Health, this is the time for Kenya to stand up. And so far, I want to confirm that we do not have any single case of Ebola. That means that there are things that have been done. The fact that we have screened 55,000 people means that we have the capacity to test. Other countries are relying on us on that capacity to test. We have not seen any health professional that is concerned or that is panicking, meaning that they are assured of the confidence that the country has. We have a number of Kenyans who were in Sierra Leone, including our very good friend, the chairman of the Kenya Union of Clinical Officers, Peterson Wachira. He can say this for himself, among many people who were in Sierra Leone. And none of them, first of all, got infected in the 2 years. None of the Kenyan health workers, we lost them, and now they are in country. So in fact, some of them have reached out to us, telling us that we are ready. We have deployed a number of them in our isolation center in Kenech, in isolation center in Alupe. We also have a number of other isolation centers that we built during COVID at the county governments. And some of them are also helping us with the public health emergency operation centers that we have at the national level, and also the ones that we have at the county level, 15 of them. So we want to thank our healthcare workers for this strong show of response and a strong show of readiness to respond to any case of